provide the infrastructure and are really just trying to facilitate an environment and inspire the best talent to come in, and instead of building stalker apps or coupon companies, focus on solving the biggest challenge of our time right now, which is fixing this broken healthcare system. But we think one of the best ways, or most efficient ways, or even realistic ways to fix the broken healthcare system is to build an army of entrepreneurs and innovators to tackle one challenge at a time. So if we have thousands of entrepreneurs, each building a business that focuses on one specific aspect of the problem, cumulatively, as a collaborative, as a network, we can fix a big part of the problem. So I think we're entering an epic decade of innovation and transformation in the system, where there's this creative destruction going on across the whole system. It's being completely reinvented. It's being reimagined by doctors, doctorpreneurs, by startups, by sort of entrepreneurs that are bringing new types of technologies that have worked in other sectors, whether it's mobile or internet or even the music industry or social networks, and bringing these same constructs, these same ideas over to healthcare and really sort of trying to reimagine it from the ground up. And then you mix in the digital revolution. Things that weren't possible 3 years ago are now possible, whether it's because of an iPad mini or a watch or big data and analytics tools or the human genome and genetics. There's things that are now possible that even a few years ago aren't possible. And you mix all these things together, it's creating an environment that's right for sort of healthcare innovation. So there's really never been a better time to be a health and wellness entrepreneur. So what's happening now that's really exciting is there's this community forming. There's peer networks. Startups are collaborating. There's an ecosystem forming where the governments are getting involved at federal levels, international organizations, state and local levels. There's healthcare organizations, whether those are hospitals or insurance companies or big healthcare companies. There's foundations. And there's this early stage sort of innovation ecosystem that's just starting. It's very sort of grassroots, if you will. But these people are working together and banding together using networks like StartupHealth.net and others to collaborate. So I think it's because of this sort of collaboration that we have a chance to sort of speed up the cycles of innovation faster than maybe have happened in the past. We're all patients. You know, we in our daily lives see how we're doing things differently, whether it's going shopping or booking airline flights or using your phone and your technology. And now we're asking ourselves, why can't we integrate these same ideas, this simplicity, this beauty, this great design, this positive attitude into our health and into our wellness and into our healthcare? So I think there's this inevitability, quite honestly, about what's happening, where it's, this new phase of innovators and this community are just going to force change. There's also things like design, thinking about how to redesign healthcare so that it becomes a part of your life as opposed to something that's sort of obtuse and sort of scary and something that's separated from your day-to-day existence. We work with a lot of wonderful entrepreneurs at Startup Health and companies like this Basis, which is a device that measures everything from your heart rate to your calories, to your movements, to your sleep patterns, to something called galvanic skin response, which measures your stress levels. It does this automatically. You don't have to do anything. And so you start to build this whole sort of health profile that you can then take into your doctor once a year and sort of review your patterns and sort of reshape your day-to-day sort of routine based off of data and based off of signals. So one of the things I'm most excited about, a lot of people have been talking about mobile apps and mobile health apps and mobile health. But what I think is really going to be quite fascinating over the next few years is the explosion of sensors and how these sensors get integrated into everything in our life. So if there's billions of mobile phones, there's going to be 100 times that in terms of sensors. So as an example, there will be sensors in your car seat, on your steering wheel, in your airplane seat, and they'll be on your clothes, they'll be in your Band-Aids, they'll be embedded into your medication, onto your pill bottle. Literally everything will be connected, and it will hopefully be automatically sort of recording and tracking things that can hopefully provide back useful data and information to you as a person. So let me give a simple example. If you're sitting on an airplane seat, it will let you know and vibrate if you've been sitting in one place too long, so you don't get blood clots in your legs. Your steering wheel will measure your stress and control the car in a certain way, so you don't get in a car accident. These types of things can completely sort of reinvent everything, because if everything becomes sort of connected and smart and intelligent, whether it's in your clothes or on your devices or on your refrigerator, it will basically incrementally, I think, sort of help improve our behavior and help change our behavior over time. And I think that's going to impact our health. There's this sort of fear about what privacy means, and the real issue is, if I'm as a person, as a patient, giving up access to data or giving up certain elements of my privacy, what's the benefit to me? Is it improving my health? Is it saving me money? Is it making my life better? What is it doing for me? So I think if we shift away from the concepts of fear around privacy to figuring out how privacy can actually be a benefit for the individual, leaving them in control, we can completely shift things. It doesn't matter if they're ready. This is an inevitability. It will happen whether they like it or not. Look at what happened with the music industry as an example. They spent years and years and years trying to sue their customers, which is just absurd. And the forces of creative destruction transformed the entire sector anyway. And I think creativity and music and the whole industry long term is much better off as a result. And certainly music lovers are better off. So I think the same thing is going to happen in healthcare. And whether the old guard wants it this way or not, it's just an inevitability.
How is technology changing your world? Join the conversation at tdo.org/pull.